Good afternoon and welcome to our next webinar in the series of virtual care tutorials. Today we're going to talk about providing advice on complex diseases. With me today is Mark Ayer, our Director of Customer Operations. Mark, are you there?
Hello, Jeff.
Hi, Mark. It's good to hear your voice again. We're used to, well, actually, I don't think I'm used to being in the office with you anymore, but it's
I
going to
don't
be
think we've
strange.
seen each other in several months, Jeff.
No, it's been too long. Your picture looks good though. I appreciate seeing it.
Thank you.
So we're going to dive in and we're going to talk about how you can use SecureML to work with your chronic care conditions that you have, do check-ins, that sort of thing. Because nowadays, you don't want to necessarily bring people into the clinic if you can avoid it. A lot of times with chronic care patients, especially if they're controlled, and then you can just look at their latest results, shoot them a quick message, hey, how are you feeling? I had one of those today with one of my providers, so it's really good and easy, and they can write back and say, hey, here's how I'm feeling. That information can now be copied into a patient record within the EMR, so that you have that captured rather than a phone call where somebody's scribbling, transcribing, and trying to type notes at the same time. This allows everybody to focus on providing the care. So what you can do with SecureML, it's a lot like a face-to-face visit. And the interesting thing about this is there is research that shows that secure email communication between providers and their patients really closely mimics from a coding standpoint, an in-office visit. So, there's a salutation. Hi, how are you doing? How are you feeling? What's going on? How are the kids? Into, some questions, an interview, and a wrap-up. And the other really interesting thing about that is email communications on average take a clinician about 2.3 minutes versus an average of an in-office visit of about 12. So there's real efficiencies to be had here, especially if you're just doing quick follow-ups. You can touch base with patients. Depending on their condition, especially now, you can help ease anxiety just by doing that. Make sure they're taking their medication, make sure they're following their treatment plans so that you don't have patients that are doing great fall into remission. They can forward to get input, they can forward that message to a caregiver so they have the information. Maybe their kids need to be brought up to date if it's a senior, or a spouse, if we're talking about their children. Hey, here's what the doctor said about little Billy. And there's that record of conversation for the patient to review. So the patient can always go back to a SecureML message. It's in the palm of their hand or in their pocket, and look up the message and say, oh, what was I supposed to do? Oh, there it is, right? That's what the doctor told me that I should be doing to change my treatment plan or my regime going forward. The big thing here is attachments. And, typically if you're just checking in with a patient, how you're feeling, you might send a questionnaire. So it could be a Word document or a PDF. It could be some text you paste into the body of the message. There are clinics that do that. So you can send up to 500 megabyte attachment per attachment, and as many of those attachments as you need to send. You can send, like I said, forms, documents, here's your patient record, here's your file, here's what the specialist said about your condition, that sort of thing. Lab results, any pictures, x-rays, videos. So pictures and videos as well, interestingly, can come from patients. So, hey, how's it going? Any swelling in your ankles? Yes, there is. Can you send me a picture of that? Or how are the tremors? Have you been experiencing any? Did you have the seizures back? Yes, they are. Can you capture a video the next time it happens and send it to me? Yes, I can. Here it is. Any kind of rash situation, all that stuff, patients can do this. So you have that, and that also gets attached to the patient record, but it's a really great diagnostic tool for things that you can't schedule. So things like tremors, seizures, when it happens, have someone take a video and send it to me so I can observe it. And SecureML really allows you to do that. We've worked with clinics who were actually surprised and impressed when patients started sending them that on their own. So patients can figure out email. They know how to use it. And because SecureML is just like email in so many ways, except in the fact that it's actually secure and compliant for use in healthcare, it's easy for patients to figure out, and they do adapt to how they use it in their regular day-to-day life. So with that,
Jeff, before we move on, if I may interrupt for one quick sec here. One of the most common use cases for the sending of photos is, it seems obvious when I say it out loud, but a lot of people don't get it right away, which is If you fill in a form and need to send it back to the doctor, and you filled in a form with a pen and paper, people don't have scanners in their homes anymore. People haven't had scanners, much like fax machines, for going on 20 years now. At least patients don't have those devices in their homes. But with your phone camera, whether it's an iPhone or an Android device, you can scan a document to a high resolution PDF and directly upload it and send it through secure mail, which saves so much time when it comes to getting, written information from one place to another. So one of the most common use cases, and you didn't happen to mention it, so I thought I'd just interject. Sorry
No,
to
that's
interrupt.
great. Thank you. And no, you're right. And I heard that feedback quite a bit. And even because that was been a question that people said, well, what about, but patients don't have scanners? And that's exactly the answer that is used widely today by secure mail users. And there's over 100,000 patients doing secure mail. I was going to say doing that, but they're not all doing that. But so let's just take a look at this workflow real quick. So a patient, in this case, the family practitioner writes a patient just to check in. Hey, it's been a couple months. The world is a different place. How are you feeling? How's this? How's that? Can you send me your latest blood sugar monitor data? That sort of thing. And the patient can respond with detail about their condition. The great thing about using email instead of a phone consult is you lose the chit chat. It's way more efficient. Even if a patient writes a couple paragraphs about their grandmother, that can be skipped and ignored, not addressed, unless it's relevant. And now the patient can respond with pictures, videos, descriptions of everything they've done. Maybe there was a form attached, they filled out a questionnaire, and either at that point, when it comes back to the clinic's shared inbox, it's forwarded to the clinician for review, or if it's a form that's come back, an MOA enters the data into the patient record and notifies the physician that there's something there to review. Now, based on the response from the patient, is the condition under control? Yes. Okay. Hey, everything's great. Keep doing what you're doing. We'll check back in a couple of weeks or months. Or no. Hey, you know what? Seems like things have changed. Why don't we book you in to come have an appointment? And here are some dates to schedule, or just a quick phone call. We have some time tomorrow afternoon. If you're available to come in, the doctor would like to see you based on this and this and this. Or it might even be something as simple as, here's some information that you need to know. We've sent your prescription changes over to your pharmacy, and let's try doing this and this and getting more sleep. So really easy to have a back and forth. If the patient has any questions at that point, that can either be done through secure mail or you schedule a phone or video consult. With that, let's hand things over to you, Mark, so you can take us through the demonstration.
All right, let me turn on the screen broadcast from my point of view, and that should be coming up right about now. So, little unorthodox here. I'm actually showing the point of view of the patient. Normally, I would show the clinician doing some work, but let's take a look at how this appears from the patient's point of view. So they've received an email notification to their regular old-fashioned email inbox that says the Fouchard Clinic has sent you a message on Brightsquid Secure Mail. Click here to go and see it. Our patient, his name is Adam, has now logged in, and waiting in his inbox is this recent message. It's in bold, showing that it's unread. Is a message from his clinic sent by Clara, one of the staff members there, presumably. And the subject line is check in on GI conditions. Let's have a look at what this message says. So Clara, the office manager or MOA or reception at my medical practice, my doctor's office, has sent me this message just indicating that it's been a few weeks since you came in and had a new prescription, and the doctor wants to know how you're feeling. Now, this is super simple. Jeff talked about a lot of different things, different use cases as to how this could be meaningful, whether it's for, dermatological conditions, neurological, psychological. I picked a really simple use case example here, which is, hey, you have a new medication for your acid reflux condition. Has it helped you or not helped you? If it's helped you, great. Just let us know and we can move on to, everything else we need to do in our day. But if you're feeling any less than fantastic, contact us, come in, book an appointment, book a remote consultation, or whatever you might need. Now, I'm the patient here. I'm going to pretend that I'm Adam for a sec, and I'll say, I'm feeling pretty good, but I do have a question that I want to address. So I'll just reply back to the practice. And when I reply, you'll notice that, oops, looks like I did something with the demonstration environment. It's giving me an error message. That's fine. We can ignore that. I can just send a note back to the practice and say, hey, I'm feeling better, but my prescription is running out on Thursday. Can you please send me a renewal? or I have a question about some other condition, I can send all that, and I won't try to get too fancy here, but I can just type whatever I needed to here and send that back to the practice. So it opened up the door for the patient to respond back to their doctor's office and just have a conversation without having to book an in-person or even a remote video chat consultation. A lot of this can be done through these sorts of written consultations or written interactions, which for most patients of a certain demographic are far preferred over getting in their car and driving down to the doctor's office to have an in-person consultation. I think you'd agree, wouldn't you, Jeff? Jeff, have I
Yes,
lost you?
sorry, Mark. I was on mute, but yes, I do agree.
So let me turn it back over to you.
Yeah, for sure. Let me grab here, and we're back. So that brings us to the end. I mean, really quick, easy things. As we point out, using SecureMail is not always every time you do it with a different job. It's not always different functions and features, but it's all about how you employ those functions and features. And the more of these webinars that you see, the more people tend to have light bulbs go off in their head, say, "Oh, and I could do this. Oh, and I can do that." So it's great that you're checking this out. I will say there are additional resources you can take a look at. If you haven't done your privacy breach risk assessment yet, I do suggest you do it. If your PIA is a little bit out of date or you haven't done a PIA, it'll really help give you a picture of where you need to fill some gaps in terms of your privacy and security system. We do also have weekly SecureMail training. So that goes into the real nuts and bolts of SecureMail, how to configure your clinic's account, how to get people into the shared inbox, how to make sure patient messages are going to the right place and not showing up in a physician's inbox that's never checked, how to set up your, if you have multiple teams in your clinic, how to set up the management of that, how to help staff move between different teams with the same account, all that kind of stuff is in our training. So please tune into that if you can. Again, my name is Jeff, and Mark, thanks so much for your time again today. Anything else to add before we sign off?
No, thanks so much, everybody. Have a great afternoon.
Bye now.